is guided by a set of code and conducts. For doctors, there are some ethical guidelines, nurses, ethical guidelines, even barbers, even carpenters. So caregivers are not an exemption. Ethical guidelines is more than good character, is more than morals. Ethical guidelines essentially are what would allow you to practice safely with the best intention of your patient or client at heart. And ethical guidelines, if any medical personnel ever does something that is legally indicting, that can lead to litigation. Litigation are like lawsuits that can follow some medical practices. So if anybody ever does something that is legally indicting or leads to lawsuits, it would always be weighed against the ethical framework. Which ethics did this person flout? How was this person in error ethically? It has nothing to do with morals. It has nothing to do with how well the person is, how well the person behaves at work. It is, are you ethically correct or ethically wrong? And the truth is, the caregiving profession is a profession that you'll be caring for persons at their most vulnerable state. They are literally entrusting their well-being, their dignity, and sometimes even their very lives into your own hands as a caregiver. So the onus is on the caregiver and on every medical personnel to be ethically minded in the care of their clients in every opportunity they get to care for such a client. So the first ethics we'll be discussing is called autonomy, and is also described as respect for autonomy. Autonomy essentially means that your patient reserves the right to make decisions as regards how they would be cared for, even when those decisions are different from what you would have chosen had it been you were in their own shoes. They are in their own shoes. You, the caregiver, you are not in their own shoes. So, and respecting your patient's autonomy will then mean that you would give your patient opportunities for empowering choices. What do I mean by this? You have an 80-year-old woman. Empowering choices will be simple, like asking, what do you want to eat this morning? Not what you have preconceived. Would also include, even though you know that this my 80-year-old woman, elderly patient, should have exercise twice or thrice a week, you will still need to empower your patient's ability to make a choice as to whether she wants the exercise now or later in the evening. So that will be you requesting, ma, sir, you are supposed to have your exercise today. I think we can go now. Do you think this is a good time for us to go for such an exercise? And then you wait for your patient to say yes or no, he or she is ready, without mandating or insisting that a certain kind of treatment has to be done the way you want it at the particular time you want it. So respecting autonomy means that you would empower your patient with the ability to make choices. Then there's another entity called informed consent, or obtaining informed consent. This would have to do with when you have to do procedures, carry out procedures on your patient. For instance, if you were given the responsibility of dressing your patient's wounds. Informed consent means you're going to explain, this is what we're going to do. It will be a bit painful, but I would be gentle about it, and so on and so forth. Then the informed consent comes from the patient to say, now you can dress the wound. Not, I am on duty, I have a number of wounds to take care of, I do not have the luxury of time to be waiting for your decision. Informed consent, you must wait for the patient to demonstrate that I understand what it is you want to do and I give you the permission to go ahead. That way we'll be respecting our patient's autonomy. Then support for self-direction. Here you are facilitating your patient's independence and self-management as much as possible. Even for patients with significant limitations, that will be patients with some form of developmental disabilities that you will know many of these things, they are limited to be able to do it themselves. You will still want to support their self-direction, give them the impetus to say, I still want it like this. Then you, of course, you are then doing the support to make sure it works the way it is going to work. Take, for instance, someone who is wheelchair bound and would want to go out in the evening to be able to enjoy hair from outside. You notice your patient who is wheelchair bound cannot go out by himself or by herself. Supporting self-direction will then mean you would be positive about wheeling your patient out to the balcony or to the frontage of the house as the situation may be, rather than say, if you can get there yourself. So that way you'll be supporting and respecting your patient's autonomy. Then acknowledging values and beliefs. By the time you care for people, you would find that values may be very different from your own. Take, for instance, you care for someone who has a very different religious or spiritual inclination with your own, or someone who has a very different marital inclination from that you have, even though it's different and is not what you would have wanted for your own life. When you acknowledge and respect people's values and belief, you let them have it as they want it, keeping in mind that your primary responsibility with that patient is to cater to their health and supporting them to be who they have always been as much as possible. So those are the four harms on which respect for autonomy is hinged on. So the second part of ethical framework in caregiving that you have to keep in mind, because like I said earlier, if there will ever be any case of litigation, usually it will be hinged on which ethical framework this individual flouts. Then when you keep ethics at the back of your mind, for every interaction, you can always ask yourself, am I being ethically mindful as I'm caring for this patient? So the second harm of ethical framework in caregiving is beneficence. Beneficence just simply means that you're acting in the best interest of your patient. And it compels you as the caregiver to actively work for the good and the well-being of the patient you care for. That is what you're going for anyway. But then ethically, beneficence mandates that this gets done. And on what does beneficence hinge on? It hinges on your ability to provide competent care. There is care and there is competent care. There are informal caregivers like relations, cousins, and neighbors on the street and the likes. But you, the professional caregiver who has been adequately trained and equipped, you are expected to be competent and be able to deliver the responsibility that is delegated to you with the best of expertise. That is where beneficence comes in. So the onus is on you to craft your skill so well that you are as good as you can get. Then beneficence also means that you would be promoting your patient's well-being. So, you are not just there to address physical needs, assist with activities of daily living. No, you would also be there to cater for emotional, social, and sometimes spiritual well-being. So, and this one might include getting your patient involved in meaningful activities. You may be needing to take up the responsibility of fostering social connections, being sure that your patients are interacting with social relationships, could be friends, could be neighbors, could be peer groups, especially for persons who are physically challenged, just to be in a way that you will be promoting that individual's well-being. Then you would also want to advocate for your patient's needs. So sometimes as the caregiver, you're the only one who can speak up for the rights and the needs of your care recipients. That may be you speaking up to be sure that necessary resources are made available. So for instance, you care for an 80-year-old that you will know this woman will be better off on a wheelchair rather than being lifted from chair to bed every now and then. Advocating for the needs of your patient will then mean you are either reaching out to your supervisor, whose responsibility it is to reach out to the agency, or to reach out to the individual, the children taking care of this patient, if it is a private contract, so to say, to see to it that this patient of yours who is in need of a wheelchair gets one wheelchair given to her or purchased for her. So that way you'll be advocating for the need of your patient. Then another harm of beneficence is that you want to prevent harm to your patient. We talked about preventing falls in the house. While it is a part of being a competent caregiver, it's also a way you are proactive against preventing your patient from getting injured. So you take proactive steps to minimize risk, to ensure that their environments are safe, and determining what is generally in the best interest of your patient. So that is the second harm of caregiving ethic that is expected that we keep abreast of in our line of practice. Then the third harm of ethical framework in caregiving is non-malfeasance. It essentially means, above all, do no harm. This is the cornerstone of ethical practice for caregiver and essentially every other person in the field of medical practice. And it includes one, preventing physical harm to your clients. More often than not, you hear stories, you watch videos of caregivers even harming the clients they've been called to take care of physically. That is completely unethical. So beyond you not being the one to inflict physical harm, you also want to prevent physical harm to your patients. So you want to ensure safety in their environment. You want to ensure that you are using the proper techniques to transfer your patient, proper equipment to mobilize your patient. Picture that 80-year-old that I said cannot walk and would need wheelchair. If every single time you're holding the hands of this your 80-year-old patient to get from the bed to the chair, she would probably have a fall one day. A little fall could result in a fracture. That way, it will not be said that the caregiver was preventing physical harm to these patients. So being proactive in the care of your patient such that your patient never experiences physical harm is essential as you practice non-malfeasance. Then you also want to be vigilant for signs of injuries or illnesses. It could even be a patient who is bedridden and then begins to develop bed sores. Those are wounds on the pressure areas. Could be in the buttocks, could be under the elbows, could be under the heel, could be on different parts of the body. You, the caregiver, must be proactive to observe that some of these things are going on and be able to give the first necessary care in such a situation. Then you also want to avoid emotional and psychological harm. So you want to treat your patient with respect, you want to treat them with dignity, you want to avoid demeaning languages or actions to the individual you're taking care of. You want to be sensitive even to the emotional needs of your patient. So even if you're taking care of a 100-year-old who is senile, who is demented or has Alzheimer's disease and cannot remember a lot of things, so your 800-year-old patient may be acting like a 4-year-old child. It is still on you to remember that this patient is not a child. This is a 100-year-old elderly woman who should be treated with respect and dignity, regardless of any medical challenge she may be struggling with in her old age. Then, of course, when you observe cases or situations where there is abuse and neglect is commonly expressed by persons with physical disabilities, mental disabilities, or children with developmental disabilities. And you, the caregiver, many times will be the first person to observe such signs. You observe such signs, you already know the drill. You reach out to your supervisors. You don't neglect or ignore such. That will still be counted as you neglecting the care of your patient in this case. Then the fourth arm of caregiving ethics is justice. Justice in this sense essentially means ensuring that there is fairness and equity in the care of your patients. It demands that you as the caregiver, you treat all the individuals that you have been called to treat fairly and equitably, without bias or discrimination, regardless of the age of the person, the gender of the person, the race of the person, the religion of the person, the socioeconomic status. Is he a poor person? Is he a wealthy person? Or even the nature of their condition. So even if you've been called to care for someone who has schizophrenia, or someone who has stroke and is bedridden and is messing up all their body, you will still care for that person with the same fairness as you would care for the mother of a minister. Even if the mother of the minister can do everything for herself and she's not constituting so much stress to you as this individual with stroke is, The principle of justice demands that you treat the two of them fairly, without considering that this individual is highly placed with some net worth, and then giving some preferential treatment to such an individual at the detriment of the other patients who may not have so much to offer. So the principle of justice demands that we exhibit fairness and equity in the care of our patients. And that would then mean fair allocation of resources. For instance, if you work in a care home where there are a number of clients that needs to be attended to, fair allocation of resources means that when you decide who would get to use the wheelchair at a particular time, supposing it is not enough to go around, your decision is not partial. You make an impartial decision about how you will distribute your time to the patient, how you distribute your attention to the patient, and how you distribute even the resources that are available to such patients. So it will be distributed in the order of who needs it the most, not for any other sentimental reason. So if there's one wheelchair and we have 3 patients, and I have a 60-year-old who can walk with a walking stick, and I have a 90-year-old who is completely bedbound, and I have an 80-year-old who does not even want to leave her bed because she says she wants to rest today, who gets the wheelchair will be dependent on who needs it the most. It will probably be that 90-year-old who is bedbound that needs to be taken out just so that she can have some sunlight. So you understand the analysis of justice and fair allocation of resources like that. Then you would also want to avoid discrimination. Discrimination happens a lot in generally medical parlance, and the caregiving field is not exempted, and discrimination can happen on the basis of people's background, religious inclination, circumstances, and a number of things. So that I am a Christian does not mean I would discriminate an Islamic care recipient or discriminate a Buddhist care recipient. I still want to provide the same quality of care and respect to everyone, every client, every care recipient I'm called to care for, regardless of their background, their religious inclination, their race, their financial status, or even their health circumstances. So the fifth and the final harm of caregiving ethics is fidelity. Fidelity means you're upholding the truth, you're upholding trust and loyalty at all costs. So in your relationship with your patient, you want to be sure that you are truthful, you are loyal with the care of the patient you that are under your needs, under your care. And that will include that you are honest and transparent. You want to communicate truthfully as to your availability. If you say you're going to be there by 5, let your 5 be 5. Be someone of your own words. If you have to take care of the procedure and you know it's going to be painful, it's unethical to tell the patient, oh, no, this will not be painful. You tell them it will be, but I will be gentle. Or someone has, maybe you had a message from the child that says, I will not be coming. And you've been told not to communicate with the patient that the child is not coming home for that weekend. The principle of fidelity would not permit you to go and lie that the child is coming. If you've been told the child is not coming, is not coming, you either keep quiet about it or you do not tell a lie, because otherwise you'll be undermining the ability of the patient to trust in you, to rely on you, and essentially undermining a fundamental ethical principles. So still under the principle of fidelity, if you keep a promise, if you promise the patient, okay, though I'm not on duty, but I'll come to check up on you on Saturday at 3 p.m. You see to it that you follow through on your commitment, and you see to it that you present yourself as a reliable individual. Then still on the principle of fidelity, you want to maintain your patient's confidentiality. So you are protecting your patient's privacy of personal information, privacy of their own physical body, and you only share information on a need-to-know basis. On a need-to-know basis with your supervisor or with your patient's children or relations. And such information on a need-to-know basis would be with appropriate consent, that you've taken permission, you've spoken with the patient, and the patient understands all that you're going to say and gives you the consent to go ahead in such a situation. Then still the principle of fidelity means that you are establishing and maintaining professional boundaries. You know, after a while of being in the caregiving profession, one may begin to blur the lines of professional boundary where it begins to cross from being a caregiver to a daughter, an informally adopted daughter or an informally adopted son. Fidelity means that you are defining and adhering with appropriate ethical limits in your caregiving profession. So the relationship between your recipient and you, the caregiver, has to be well defined, and it has to be maintained strictly in that professional tone. Otherwise, one will be considered to be flaunting the ethics of medical or caregiving profession. So now, in conclusion, the ethics of the caregiving profession, they're not just set of rules to be followed. They are not just set of rules. They are the fundamental orientation that will shape the very essence of the care you offer. And when you embrace this principle of autonomy, beneficence, non-malfeasance, justice, and fidelity, you'll be able to navigate the complex landscape of caregiving, because caregiving, it could look very simple. It could also be very complex sometimes. But it is only when you've adhered with this set of guiding code and conduct that you'll be able to navigate them safely for as long as your practice will be, without having hassles, issues, or litigations, as the case may be. All right, so on that note, we end this very brief lecture. Do we have any question that we can take before we call it a day, please?
No, ma'am.
Okay. Do we have any question, Mrs. Jeje Lowo? Do we have any question?
No, ma.
All right. Okay, thank you very much. Enjoy the rest of your weekend. So admin will reach out to you with a plan for the next module for next month, and then would also send the video links to you. Have a wonderful weekend. Regards to your family.